Hello and welcome to this week's presentation on accreditation and regulation for patient medical records. Healthcare facilities and providers are licensed by state, federal, and local governments and laws. Additional self-regulation by following a set of recognized standards for healthcare organizations and voluntary participation in surveys and audits by accreditation organizations can assist in compliance with government requirements. A hospital is a very complex organization that is regulated by various agencies and organizations. They have rules to follow under federal, state, and local guidelines. There are also various voluntary organizations that provide additional guidelines for hospitals to follow. Government regulation influences healthcare delivery organizations in two ways. First, facilities are directly controlled by agencies that issue permits and licenses to operate facilities and various departments within them. Second, healthcare organizations are influenced by the rules of government agencies that reimburse them for treating patients. One of the most important is the Centers for Medicare and Medicaid Services, or CMS. Statutes and regulations are what govern some hospital functions. There is a difference between the two, as pointed out on this slide. An important note on this slide is CMS is responsible for developing and implementing the Medicare conditions of participation for hospitals. That will be discussed in more detail in the upcoming slides. Just as a further example, this slide lists the various rules, codes, and regulations that must be followed by hospitals. As you can see, they are on all levels: federal, state, and even county. State laws provide detailed regulations concerning the operation of facilities, sanitation, medical and nursing staff requirements, and patient records. Even within the licensure of the hospital, the state may limit what services can be offered or require special licenses to operate certain departments within the facility. State agencies that regulate and license healthcare conduct regular visits and inspections of facilities, of their record-keeping, operations, and compliance with state requirements. Local governments in many areas also require county or city licenses and may conduct inspections as well. In addition to licenses and inspections, facilities are also required to report incidents that involve infectious diseases, child abuse, and certain injuries such as gunshots. State and federal governments also require facilities to report a substantial amount of statistical data concerning birth defects, cancer tumors, and on the patients using that particular facility. Acute care hospitals also have additional regulations and standards if they choose to become accredited or certified with an organization. This slide lists examples of those organizations. The Joint Commission will be discussed in more detail in upcoming slides. Before we discuss the Medicare conditions of participation for hospitals, let's go over a brief history of both the Medicare and Medicaid programs in this country. Both were created in 1965 under the Title 18 of the Social Security Act of 1935. They are both governed by CMS, which is under the Department of Health and Human Services, or HHS. Medicaid provides health benefits partially paid by the states for people who are blind, have a disability, for pregnant women, and some other groups. Hospitals choosing to participate must apply to their state agency. Most hospitals would not survive without accepting Medicare patients. Medicare is the largest payer of healthcare services. In order for hospitals to treat Medicare patients, they must follow the conditions of participation for hospitals. We will discuss that in more detail in upcoming slides. For informational purposes, this slide lists the qualifications for individuals to obtain Medicare. There are also different subsets or parts of Medicare, parts A through D, as listed on this slide. You must be at least 65 years of age, have a qualifying disability, or have been diagnosed with end-stage renal disease. In order to prove disability, medical records are sent to the Regional Disability Office for review and approval. Not all recipients have all parts of the Medicare program. Some are voluntary. The next few slides discuss the Medicare conditions of participation for hospitals. This first slide gives the overall requirements of the medical record. A hospital is required to have a medical record service, area, or department. The conditions of participation also state a medical record must be maintained on every patient that is seen in the hospital. This slide gives the first standard from the conditions of participation, which is organization and staffing of the medical records department. Hospitals are required to have staff responsible for maintaining the medical records. The functions are to ensure prompt completion of medical records, filing of records when they are completed, and retrieving any records needed for patient care or hospital functions. The next standard has to do with the format of the medical record and the retention period of the medical record. Records must be kept a minimum of 5 years. If the state has a more stringent retention period, that will be followed. For example, if a state states their medical records must be kept for a minimum of 10 years, the hospital located in that particular state must keep their records for at least 10 years. This standard also addresses how records must be indexed or coded. This is normally done in a hospital. The conditions of participation requires diagnoses and procedures to be assigned to each medical record. Lastly, this standard mentions how records must be kept confidential. There must be policies and procedures in place to address how records will be released to those authorized to obtain copies. The Health Information Management Department handles the release of patient information in a hospital. The Medicare Conditions of Participation has many standards that address documentation for all areas in the hospital. This slide lists some of those areas. The Conditions of Participation goes into detail as to what types of documentation are required for each area and who is allowed to document in each area. Deemed status means an organization accredited by the Joint Commission is deemed to be in compliance with Medicare. Even though a hospital has been accredited by the Joint Commission, it can still be surveyed by Medicare. About 10% of hospitals that go through a Joint Commission survey also go through a Medicare survey. If a hospital is not accredited by the Joint Commission, they will undergo a Medicare survey. There are federal requirements for health records containing special information. The requirements are necessary to protect the sensitive nature and privacy of the contents of the records. They are psychiatric or psychotherapy records, substance abuse treatment records, records containing HIV/AIDS information, and records with genetic testing or genetic information. Accreditation is a voluntary process that hospitals decide to participate in. They undergo a review based on established standards of performance. There are different organizations that accredit for different reasons. The major organizations are listed on this slide. The most common is the Joint Commission. The Joint Commission is a not-for-profit organization that accredits all types of healthcare organizations. They work both nationally and internationally. Their mission is to improve the safety and quality of healthcare provided to patients. Just as hospitals participating in the Medicare program follow the conditions of participation for hospitals, hospitals that are accredited by the Joint Commission follow the Comprehensive Accreditation Manual for Hospitals, the Official Handbook, or CAMH for short. The Joint Commission Manual is divided into three main sections that are patient, organizational, and structural. The Management of Information, or IM for short, section of the Joint Commission Manual mainly applies to a hospital's Health Information Management Department. They are required to have policies and procedures in place to address the 6 areas listed on this slide: planning, confidentiality and security, information management processes, information-based decision-making, knowledge-based information, and patient-specific information. There are additional standards related to patient medical records listed on this slide. Different departments may have the policies to address the standards, such as pharmacy for the medication management portion. Hospitals that are accredited by the Joint Commission are required to report on sentinel events. This type of event is unexpected that may lead to the death or injury of a patient. They normally could have been avoided. Hospitals should feel comfortable reporting such events to the Joint Commission. The reporting involves a summary of what happened and steps put into place to avoid it from happening again. Examples of sentinel events include infant abductions and deaths within the facility. Every year, the Joint Commission publishes National Patient Safety Goals. Their purpose is to promote patient safety. The next slide lists some of the current safety goals. You can see on this slide there is a wide range of safety goals currently being addressed by the Joint Commission. Under each goal, there are several standards that are addressed. For example, under Prevent Infection, the standard requires hospitals to use hand-washing goals published by the Centers for Disease Control and Prevention, or CDC, in eliminating the spread of infection. The Joint Commission performs unannounced surveys. This means they do not give notice when they are coming to visit a healthcare facility. This survey process requires facilities to be prepared at all times for a visit. They do, however, get about a 1-hour notice. The Joint Commission will publish on a secured website if they will visit a facility. That facility can log in and view their page to see if they are about to receive a visit that morning. Hospitals get surveyed by the Joint Commission every 3 years, if not sooner. To keep in compliance with the Joint Commission standards, hospitals are required to complete an annual periodic performance review, or PPR. The PPR is a review of each standard and how the hospital is remaining in compliance with those standards. This tool can be completed electronically. This slide lists the 6 categories of Joint Commission accreditation. One of the 6 categories is awarded to a hospital after a survey visit. Any category awarded under accredited, meaning provisional, conditional, preliminary denial, or preliminary accreditation, warrants another survey to review and ensure compliance with all Joint Commission standards. Thank you. This concludes this portion of the presentation.